Hello everybody, my name is John Rodriguez. I'm an instructor with the Miami-Dade Fire Academy. This video is going to go into patient positioning. We have the supine position, the prone position, we have the tripod position. We're going to be talking about the Trendelenburg or shock position. We're going to be talking about holding C-spine. And we're going to be talking about holding C-spine when that patient's prone and how to turn them over in the appropriate manner. If you approach the patient and they're laying with their back on the floor and their face towards the sky, that is called the supine position. If you approach a patient and they're laying with their face down and their buttocks toward the sky, that is called the prone position. If you approach a patient and they're sitting on their butt or if they're sitting in a chair and they have both hands on their knees, that's called the tripod position. And that could indicate the patient's having shortness of breath or some sort of difficulty breathing. Now I'm going to give you an example of how to do the Trendelenburg or the shock position. If you have a patient that has hemorrhagic shock, which means that there's a massive amount of bleeding, we could probably guess that their blood pressure is going to be very low. So this position is going to help raise their blood pressure. All you're going to do is find any sort of object and elevate their feet 6 to 12 inches. By doing that simple task, this could help elevate the person's blood pressure. Next, we're going to talk about holding C-spine when the patient is laying supine. This is going to be for a mechanism of injury or a trauma call. You're simply going to go down on one knee, holding the patient's neck and head in place. You're going to be driving your fingers into the person's shoulder blades. You do not let go of C-spine until the patient's placed on a backboard or until now one arrives. Next, we're going to talk about C-spine when the patient's laying prone. Prone is when they're face down and their buttocks is up. We have to roll this patient over safely and effectively. My partner here is holding C-spine. You're going to manipulate your hand so that way when you turn the patient's body, it doesn't manipulate their neck, and you also don't have to move your hand placement because once you hold C-spine, you do not want to let go. The person that's holding C-spine is in charge of the commands to move the patient. What we're going to go ahead and do is we're going to move this arm up and over, and that creates a nice platform for him to roll over. Sitting on one knee, I'm going to grasp the patient. I'm going to wait for my partner to go.
1, 2, 3.
The next position we're going to talk about is the recovery position. For this position, it's going to be indicated when it's an unconscious patient, but they're breathing. We're going to want to lay them on their side. The reason for that is they're unconscious and they're breathing. We don't want to leave them in the supine position because if they start vomiting or if they're bleeding out of their mouth, we don't want them to choke. So we're going to go ahead and lay them on their side. It helps if you prop up this arm, and I'm going to lay them on this side. By doing that, it creates a base for the patient. And that's the recovery position.